Welcome to our Block 7 video. Here we will explore the ethical dilemmas in end-of-life care. End-of-life care comprises of many different things, including not only the more well-known physician-assisted death topic, but when to withdraw or withhold care. In order to explore this topic, we will use an example of a family grappling with a difficult choice. This will outline a challenging dilemma that healthcare providers and families often face when making decisions about a loved one's care during their final stages of life. Our fictional family is the Jones family. They are currently navigating the complex choices involved in end-of-life care for their elderly father, Mr. Jones. End-of-life care poses a delicate balance between respecting patient autonomy and ensuring the best possible care. It often involves challenging decisions about treatment options, pain management, and the use of life-sustaining interventions. For the Jones family, they are confronted with the decision of whether to move to more aggressive life-sustaining treatments for their father or shift the focus towards palliative care to enhance his comfort during his remaining time. When discussing this topic with their physician, one of Mr. Jones's adult children states that, "We want to do everything we can to save Dad's life. It's hard to accept not trying the new treatment that at least has a chance to prolong his remaining time with us." However, Mr. Jones's other adult child counters with, "But we also see Dad suffering and exhausted from the intensive medical interventions already. We want to ensure his remaining time is as peaceful and comfortable as possible. Is the additional suffering from the new treatments really worth it?" There is clearly a conflict brewing in this situation between them. Situations such as this can create significant ethical dilemmas. On one hand, we respect the family's wishes to pursue all available options. On the other hand, we must consider the potential burdens and limited benefits of continued aggressive treatment. As the Jones family grapples with their decision, they face the challenging question: how can we strike the right balance between sustaining life and ensuring a peaceful, dignified end-of-life experience? The ethical dilemmas surrounding end-of-life care are deeply personal, and the answers are seldom clear-cut. I want you to reflect on this dilemma and consider the various factors that healthcare providers and families must weigh when making these difficult decisions before crafting your ethical question responses for this block. For this topic, your ethical questions to include in the journal are: if you were in the position of the Jones family, how would you make this decision? Would you opt for the more aggressive treatment that may extend your parents' lifespan but is not guaranteed and may lead to more pain? Or would you not opt for the treatment, knowing that your parent will die soon but will do so with less overall pain? Make sure to explain your reasoning. Remember, there is no right or wrong in this scenario. Also, what ethical viewpoint from the ethics module did you use to make this decision? Explain how you knew you were using this one.